Dear students, welcome back. In the previous session, we have discussed about bony parts of the hip bone in both the aspects. One is the external aspect and internal aspect, and this one is again the external aspect. Here, we are going to discuss about the muscle attachments of the hip bone. So once again, we will revise the bony parts. Okay, this mainly the hip bone consists of three bones. One is the ilium, ischium and pubis, isn't it? So ilium is located on the upper surface, okay, and that means superiorly it is placed, and ischium is placed posteriorly to the obturator foramen, and pubis is anteriorly placed, and this acetabulum is laterally placed. Okay, so this one is the external aspect of the hip bone. So normally the pubis is in the anterior aspect. So if you see the ilium part, so it is having an anterior superior iliac spine, and it is having a crest, iliac crest. Okay, 5 centimeters above you'll find here we'll have a tubercle. Okay, so this is anterior superior iliac spine. If you come along with the border of the iliac crest at the posterior aspect, again we'll find another spinous projection called as posterior superior iliac spine, and then below this thing you'll find inferior superior iliac spine. Okay, and here on the anterior aspect up to the acetabulum, the border will continue, the anterior border. So on the anterior border you will find the anterior inferior iliac spine. Okay, so this is about the ilium parts. So on the lateral surface we also find some gluteal lines. So one is the posterior gluteal line we find here, and anterior gluteal line, and then the inferior gluteal lines. So these are the parts which we observed on the external surface of the ilium. Now we will see what are the muscle attachments on the ilium. So we'll start again with anterior superior iliac spine. So here anterior superior iliac spine, the muscle which is getting originated is sartorius. So I have given all the muscles which are present in different regions, isn't it? Yes. So this sartorius comes in the front of the thigh. That means almost all the anterior aspect of the lower limb. So the muscles which are also originating from the anterior superior iliac spine. So the anterior aspect, whatever the muscles we can see here in the anterior aspect, so which are mainly present in the front of the thigh. Okay, so sartorius. Okay, and then by the side of the sartorius, another muscle called as tensor fascia, lateral to this origin over the iliac crest, the tensor fascia lata muscle is also getting originating here. Okay, so we'll move on to this on over the iliac crest. On the we are going to see the muscles which are attached in the iliac crest separately, but some of the muscles which are attached to the iliac crest, mainly this is the external aspect. That means most of the muscles which are attached to the outer lip of the iliac crest can be seen here. So one is the external oblique muscle which is getting inserted here. So this is the only muscle insertion we can find on the external aspect of the hip bone. Okay, and also another muscle, that is internal oblique muscle, is also seen here over the iliac crest. And then if you come to the posterior aspect, that means in the posterior aspect another muscle is originating, that is latissimus dorsi. This is latissimus dorsi is the back muscle, okay, and it is getting attached to the some fibers are attached to the inferior angle of the scapula, and which is getting inserted into the humerus there. So this latissimus dorsi also getting originating from the ilium only. So this one is also belongs to iliac crest. Okay, now if you see the muscles in the gluteal surface, so this gluteal surface is divided into three regions by this gluteal lines. One is the posterior gluteal line, anterior gluteal line, and inferior gluteal line. So behind the posterior gluteal line, gluteus maximus. So the name may be it's a maximus, but here the attachment is very small in the hip bone. So this gluteus maximus is having many sites of origin. Okay, so this is one of the site of origin for this gluteus maximus. So the gluteus maximus is attached behind the posterior gluteal line. And next comes to the gluteus medius. The name itself mentioned this is the medius, which is present in between the maximus and minimus, and it is also located in between the posterior gluteal line and anterior gluteal line. And next one is the gluteus minimus. So here you can find this gluteus minimus is occupying most of the space in the gluteal surface of the ilium, and this one is present in between the anterior gluteal line and the inferior gluteal line. Okay, and the muscle which is originating in the inferior iliac spine is the piriformis. So if you see, I have mentioned some of the muscles which are present below the gluteus maximus from above to downwards. So we can see the same muscle order here on the posterior aspect. Okay, so the piriformis. Okay, so in the ilium, up to the ilium, below this gluteus maximus, this piriformis muscle is present. The muscles which can be seen on the anterior aspect after sartorius. Okay, so on the anterior inferior iliac spine we can find the rectus abdominis muscle, and this one is the reflected head of the rectus abdominis muscle, and it is having two heads. One is the straight head and the reflected head. So these muscles or the rectus abdominis muscles, which is getting originating from the anterior aspect of the spine, and it is these muscles are present on the anterior aspect of the thigh. Okay, now we'll move on to this over the pubis, we can find this pectineus, pyramidalis, and the adductor group of muscles of the thigh are all getting originating here. So one is the adductor longus, brevis, and adductor magnus. All these muscles are getting originating along the pubis rami. So this is the inferior rami of the pubis. This pectineus is getting originating from the superior rami of the pectineus, as well as the pyramidalis also. Pyramidalis getting originating from the body of the pubis. Okay, and this adductor magnus is getting originating both the rami from the pubic rami as well as the ischial rami. And this obturator externus is the muscle which is surrounding on the anterior aspect of the obturator foramen is called as obturator externus. So these are the muscles we can find. So all the medial compartment of the thigh muscles are getting originating here. Okay, now again we'll move on to the posterior aspect. So we have finished up to the piriformis here, and then if you go, I have mentioned in the muscles of the gluteal regions from above downwards. After piriformis, we will see the gemelli muscle. So one is the superior gemelli and inferior gemelli. The superior gemelli is getting originating from the ischial spine, and below the lesser sciatic notch you'll get the inferior gemelli. So up to here the gluteal muscles are ending up here, and then the semimembranosus, semitendinosus, and long head of biceps femoris and quadratus femoris. So all these muscles are getting originating from the ischium, especially the semimembranosus, tendinosus, and long head of biceps. This is biceps femoris, commonly called as hamstring muscles, which is commonly located on the back of the thigh. So those muscles are getting originating from the ischial tuberosity. Here we can find a rounded like structure here, so that is ischial tuberosity. Okay, so these are all the muscles which are attached on the external surface of the hip bone. Now we will move on to the internal aspect of the right hip bone. So what are the muscles which are attached on this? Okay, now if you see, this medial aspect forms the internal surface of the pelvis also. So normally the pelvic floor muscles are attached in the pubis, okay, in the pubis and somewhat ischial region. On the internal aspect you can find the pelvic floor muscles. Okay, so if you see in the ischium, so again we can see some sartorius also here, and this forms the inner lip. Iliac crest, what we are observing, becomes the inner lip. So this inner lip gives attachment to the transverse abdominis muscle, and this is the anterior aspect, and at the higher point of the iliac crest, behind the higher point of the iliac crest, it is giving attachment to the quadratus lumborum, and afterwards it is giving attachment to the erector spinae. These are the deep muscles of the back, that is erector spinae is getting attached here on the inner lip of the iliac crest. Okay, and if you see here sartorius on the anterior side, the same rectus femoris we can also find here, that too straight head we can see on this medial aspect also. Okay, next muscle above this obturator foramen, we can find, this is the internal aspect, we can find obturator internus. Okay, the ischial spine, here we can find the ischial spine, it is present on the internal aspect. So the muscles attached in the internal aspect of the ischial spine are coccygeus, levator ani, that is the most posterior part is attached. Okay, so the same levator ani, anterior most part is attached over the body of the pubis, on the internal aspect, that is levator ani, anterior most part. Okay, if you see the rami, so you can find another muscle called as sphincter urethrae muscle, and superficial transverse perineum muscles are also getting attached here to the ischium. Okay, so these are all the muscles which are attached on the internal aspect of the hip bone. And also some of the ligaments are also attached on the medial aspect, the two on the rough area, that is called as iliac tuberosity. So what are the attachments near the iliac tuberosity is, so it is giving attachment to interosseous sacroiliac ligament in the greater part. So the greater part of this rough area is giving attachment to the sacroiliac ligaments, and more posteriorly it is giving attachment to the dorsal sacroiliac ligament posteriorly, and it is giving attachment to the iliolumbar ligament superiorly. So mainly all sacroiliac ligaments as well as the iliolumbar ligament which is attached superiorly to this iliac tuberosity. Okay, and the convex margin of the auricular surface, this is the convex margin of the auricular surface, gives attachment to the ventral sacroiliac ligament. Okay, and these are all the attachments we can see on the internal aspect of the hip bone. If you move on to the iliac crest itself, so in the iliac crest, what are the muscles which are getting attached? To understand this iliac crest, so sartorius, so this one is the anterior superior iliac spine. Okay, and this one is the posterior superior iliac spine, and this is the tubercle of iliac crest. That means this part becomes the lateral medial, that means the inner surface. Okay, and this is the anterior and posterior surface. Now we will see what are the attachments regarding to this from lateral to medial side, medial side. So at the tip of the anterior superior iliac spine, it gives attachment to the sartorius. Okay, so what are the remaining muscles which are getting attached? As we know that it is divided into ventral 2/3 segment and remaining dorsal segment, isn't it? Yes, and it is also having this crest is having outer lip as well as the inner lip. Okay, and also it is having some intermediate area. Okay, next, so this becomes the intermediate area. So what are the muscles which are attached to the outer lip? Now we will see. So the more lateral, it gives attachment to the tensor fascia lata. Okay, which is getting originating in front of the tubercle of the iliac crest, in front of the tubercle of the iliac crest. Okay, and then from lateral to medial, next muscle which is getting attached here is the external oblique. This is the only muscle which is getting inserted here. This muscle occupies the 2/3 of the outer lip. Okay, and if you move on to the behind the highest point of the iliac crest. So you will find the another muscle called as latissimus dorsi is also getting attached on the outer lip of this iliac crest. The tubercle of the iliac crest is also give attachment to the iliotibial tract is also getting attached. So what are the muscles we can see on the outer lip means? One is the tensor fasciae lata, external oblique muscle 2/3 and latissimus dorsi. If we move on to the inner lip, okay, the inner lip gives origin to the transverse abdominis in its anterior 2/3. So this is the transverse abdominis, anterior 2/3. Next one is origin of quadratus lumborum, okay, origin to the transverse quadratus lumborum, origin to the quadratus lumborum in its posterior 1/3. So in its posterior 1/3 quadratus lumborum is getting originating, and also attachment to the thoracolumbar fascia around the attachment of the quadratus lumborum. Okay, so the main muscles which are getting attached on the inner lip is transverse abdominis, anterior 2/3, quadratus lumborum in the posterior 1/3. Okay, the intermediate area. So what are the muscles which are seen in the intermediate area is the internal oblique muscle, the only muscle which is getting attached in the anterior 2/3 is the internal oblique muscle. So the attachments now we have seen are from the ventral segment of the iliac crest. Now we'll see what are the attachments on the dorsal segment of the iliac crest. So the lateral slope gives origin to the gluteus maximus muscle, and the medial slope gives origin to the erector spinae muscles. So for simple thing, so if you observe all these muscles, so all these muscles we have already studied. Some of the major muscles, one is the abdominal muscles we have already studied, and you people know about the quadratus lumborum as well as the erector spinae. So if you see the quadratus lumborum and the erector spinae, these are the posterior muscles, isn't it? So which is present on the posterior, that means the dorsal segment of the iliac crest. These muscles are present. Okay, so the remaining muscles, if you see the external oblique, so the name itself mentioned this is the external oblique, so it is present in the outer lip of the iliac crest, internal oblique, and next to the external oblique, internal oblique, and transverse abdominis, this is the innermost abdominal muscle, so it is attached to the inner lip of the iliac crest. So very easy to remember these muscles. So one is, if you know the sartorius muscle, that is the anterior superior iliac spine, lateral to the sartorius we will find the tensor fasciae lata, and then the abdominal muscles, external oblique is inserted. This is the only muscle which is getting inserted, and this one is internal oblique, and then the transverse abdominis muscle. Okay, if you move on to somewhat posteriorly, you can find the latissimus dorsi, quadratus lumborum. Still posterior, you will find gluteus maximus and erector spinae. So these are the muscles which are attached on the iliac crest. So these are all the muscle attachments of the hip bone. And also you can find the exact attachments of the semimembranosus and this hamstring muscles over the ischium. So yesterday we have seen that the ischium is divided into four parts, that is the lower end. We can see it behind below. Okay, so how it is divided means by a transverse ridge it is divided into upper and lower parts. Again the upper part is divided by an oblique ridge, and the lower part is again divided in by a longitudinal ridge. Here you can find here. So in this upper lateral gives origin to semimembranosus, and this one is again divided into two. Okay, so in this lateral, this one is medial, it is giving semitendinosus, and then the long head of biceps femoris. More lateral, semimembranosus. Okay, and another muscle, that is lower lateral, you can find the muscle called as adductor magnus. So adductor magnus is originating in the ischial tuberosity. So these are all the muscle attachments. So this is very important for viva. Okay, this point is very important. What are the muscles which are getting attached or originated? You have to mention in the ischial tuberosity. And also some of the important frequently asked questions in viva in the muscle attachments is mainly what are the muscles attached on the anterior superior iliac spine, and also the ischial spine. Ischial spine you have to mention on medial aspect as well as the external aspect you have to mention, and ischial tuberosity they will ask. Okay, so these are the commonly asked questions in the viva. Okay, be prepared for all this muscle attachments. In the next session we will see the next bone of the lower limb, that is femur. Thank you.